Hello, everybody. Welcome back to Joe's Hot Takes 25. We're in season number 2. This will be episode number 4. I already kind of covered this at the end of 2025 with my daughter, but I just want to touch base one more time on our little situation called healthcare, or do we call it sick care? Because I think maybe it's more sick care than healthcare, right? It seems like. So here we go, right? This is Joe's Hot Takes 25, where we ask the questions, we do some research, we try to provoke your thoughts. I'm Joe, I'm your host, and today hits us hard, right? In our wallets and sometimes quite literally in our guts. It's just healthcare. And I guess I got to go back and say, or should we just call this sick care? Because these days, it sure feels like doctors push pills more than they push prevention. Hospitals charge them $40 for a Band-Aid, and insurance companies, get this, deny about 20% of claims. Yeah, 1 in 5 denied. 1 in 5. I know I talked about this not that long ago, but we're back on the subject. I just want to go over it one last time with a few new things. What are we paying for? And is there a better alternative? And that Affordable Health Care Act, is it affordable? So let's unpack this whole mess that we call healthcare coverage. What a mess, and it is a mess. Excuse me. I want to start with the basics. The Affordable Health Care Act, right? The ACA, or some people call it Obamacare. The idea sounded great on paper, right? Expand access, make insurance affordable, and create a marketplace where individuals and small businesses could finally shop for coverage without going broke. And it worked, sort of. So millions of Americans who were previously uninsured finally got coverage. But like everything that involves the government, insurance companies, and money, it's going to get complicated. So let's talk about these costs. There's a lot of people that are, this is a topic that's out there. It's actually a hot take with healthcare in our federal government right now. It's still up there. But when we start talking about the costs, we all start sweating a little bit. I know I do. So your monthly premium. All right. So what you pay just to be able to say I have insurance, it depends on a few things, right? It depends on where do you live? How much money do you make? How big is your family? And what plan do you pick, right? Now, there are subsidies. So there are advanced premium tax credits. Those are what make these plans even remotely affordable for millions of people. But again, it really comes down to how much money do you make, how big is your family. In 2025, the average subsidy covered about $550 to $619 a month in premiums. Now, you're talking about millions of people that are getting a subsidy of between $550 and $619 a month to help cover their insurance premiums. Ooh, that's a lot of money. And those enhanced subsidies expired at the end of 2025. So, who's going to pay the bills, right? Who's been paying the bills? Well, I'll tell you who, right? Taxpayers, of course. If Congress doesn't step in, the premiums could double for many families next year. Now, what that means is the subsidies stop. Okay, so that's what you see, all this fighting that was going on in November with the government shutdown. You had the Democrats saying, we want those subsidies put back into place, and you have the Republicans saying, no, we're tired of taxing our tax base and taking money from them. We're tired of taking from the people that earn and giving to the people that don't earn, was basically what they were saying. So now, this is kind of, right? So again, if Congress doesn't get it handled, then these subsidies are going to go away. Now, there's another way that you can pick how much money do I want to spend, and they call them the metal tiers. The metal tiers of bronze, silver, gold, and of course, platinum. Sounds really fancy. It's like some sort of rewards program that you get for being sick. Here's how they stack up. All right, if you go into the Affordable Health Care Act and look these up, the cheapest monthly cost is the bronze. Okay, so let's first of all, I just want to say there's no affordable way to do this. There's just not. What we do is we play smoke and mirrors. So we do bronze. Bronze, okay. Obviously, bronze, it's the bottom. It's the cheapest monthly. So you pay very little every month. But if you use that, you're going to pay big. Your pay, your payouts, your deductibles, your percentages that you're required to cover, much, much higher. Most people won't be able to afford it. If you can't afford the monthly payment, you're definitely not going to be able to afford the coverage when you go to use it. Then there's the silver. It sounds a little bit better. It's right, it's silver. It's the middle of the road. You get moderate premiums and moderate out-of-pocket costs. So if you qualify, excuse me, if you qualify, you may get a little extra help from the government with the silver, but for the most part, silver's kind of in the middle. And then, of course, you have the gold and platinum. Now you're going to pay the higher premiums, right? So this is somebody that if you know you're going to be using the healthcare system more, then you're probably going to be willing to pay the higher premiums every month because your costs for care should be lower. In 2025, the average lowest cost plan was around $381 for bronze, $507 for gold, and the benchmark silver plan was about $497. So really you're talking somewhere between $400 and $500 a month is the lowest plans they had. Now, that's before subsidies. So yeah, it's affordable. If you qualify for help otherwise, welcome to Broke Town, right? But if you qualify for the help, you can get those subsidies, can knock those premiums down. So if you watch the TV, you see these commercials come on for the Affordable Care Act, and the guy goes, yeah, I got health care coverage, and it cost me $29 a month. And I sit here and blow a stack because I'm paying about $1,200 a month for health care coverage. So I'm like, how's a guy getting away with 29 bucks a month? Oh, okay, I get it. He's on the bronze plan for $381 and getting a $340 or $50 subsidy off of that. And so he's paying 29 bucks a month. Okay, I can see how that happened. But again, I'm paying $1,200 a month for mine, and my tax dollars are going to subsidize someone at bronze level, at silver level, even at gold level. Makes no sense to me. I don't like it. All right, what do you get for all that money, right? All that money you're throwing out there. All right, let's say you manage to pay that premium, right? So what do you get? You're paying that premium. What are you going to get? All marketplace plans must cover 10 essential health benefits. Now, this is research that I've done on the Affordable Health Care Act. So there are 10 essential health benefits that have to be covered. So let's run through them kind of quickly because this is where you see what's supposed to be guaranteed. Ready? Number one, outpatient care. That's number one. Two, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder treatment, prescription drugs, rehab and therapy, lab work. I can't believe this. Preventative care and chronic disease management. They actually do preventative care. Okay, that was number 9. And number 10, pediatric care, which also includes dental and vision. So those are the 10 basics. right? So you're also protected from being denied for pre-existing conditions, and preventative care like screenings or vaccines is covered at no cost. Wow, that sounds solid, right? Sounds great. You know, I can go get screenings, vaccinations, preventative care, no cost. I've got these 10 areas covered, and I'm paying the least amount as possible. All right. Well, there is the part where you still have to pay before insurance actually kicks in, right? So those are those out-of-pocket expenses. So this is the real kick in the wallet. Here's where the system starts to sting you guys. And you can go do this research. Fact check me on this. You've got your deductibles, your co-payments, and your co-insurance. All the fun stuff you pay before your insurance does much of anything for you. In 2025, the average deductible for a bronze plan, now remember that was $380 a month you're paying. Their average deductible for that plan was $7,186. Yeah, you heard it right. Over $7,000 out of pocket before they even start to cover you. Okay? Now, if you can't afford health care, but you can come up with $300 a month, $380 a month, or if you get subsidized, $30, $50 a month to pay your premium, okay. But now you have to use it. How many people have $7,100, $7,200 in the savings account? And that's just for one person. So if you've got a family of 4, you're going to have to come up with that 4 times over for each person. How many people have $7,000 that they can pull out of their bank account to get their insurance started? Yeah, that's a lot. But if you're lucky enough to qualify for those cost sharing reductions, those are CSRs, that are offered on the silver plans, I know that you can get into, your deductible could drop to under $100. So once again, if you don't qualify for subsidies, you're stuck paying more, a lot more. So, and even with insurance, you'll never really have to pay, according to the Affordable Health Care Act, more than $9,200 a year out of pocket as an individual, or $18,400 for a family. Once you've paid, now remember, you still got to keep paying a percentage, but once you've paid out $18,400 for your family, now your plans will cover you 100%. But if you're hitting that limit of $18,400 for your family, or even $9,200 for your individual, you've probably already emptied your savings out. All right. Hopefully you have the savings, but this is where people get in trouble. If you don't have the $9,000 and you have a medical procedure and you can't pay it, what happens? You can't really, what are you going to do? Try to file a bankruptcy, and you're still going to be on the hook. They're going to come after you for this money. So really, is it affordable? No, it's not an affordable Health Care Act. It's not an affordable anything. It's so overpriced, so out of reach for everybody. I don't know how anybody can say that this is good. It's probably put more people in the poorhouse because they can't afford the coverage. They can't afford the deductibles and the copays. All right, in 2025, are you ready for this? A record 24.3 million people signed up for ACA coverage. Of those, 22.3 million received subsidies. That means 9 out of every 10 people that enrolled got financial help from the taxpayers. 9 out of 10 got financial help from taxpayers. I want you to think about that. So those enhanced subsidies that were introduced back in 2021 basically made it possible for middle-income families to stay insured, middle and low income families. But boy, what does it do to most of your middle and upper class? They're paying a lot to cover those people that don't earn that kind of money. So clearly, where does that money come from? Yep, taxpayers. You, me, and the other 80% of working Americans are footing the bill for this program, right? We're paying the bill for it. And remember, 20%, right? I talked about this before in a prior podcast. 20% of Americans are already on some form of government assistance. So if 20% are already on some form of government assistance, and now we add another 22 million on the ACA getting subsidies, oh my God, when does it stop? How do you stop this bleed of taxpayer money? How do you stop it? I don't know. But it's bleeding, and there's only so much money, and people are getting tired of paying these taxes. But anyway, yeah, remember I talked about national debt, our national debt. I talked about that in a prior podcast. The national debt keeps getting higher and higher, not lower and lower. Yeah, this is part of the reason why. Really, 9 out of 10 of the people that are on ACA get subsidized. All right, so let's say you're unemployed, you got 3 kids, right? When you apply for coverage through healthcare.gov, it first checks if you qualify for Medicaid or CHIP, which is Children's Health Insurance Program. Those are often free or super low cost and actually provide better coverage than a lot of the ACA marketplace plans. So if you can qualify for those. Now, Medicaid, usually there's no premiums, minimal copays. With CHIP, there are small monthly premiums. They're capped at 5% of a family's income. If you qualify, take it. Seriously. It's usually the best deal out there, right? It's called CHIP. That's the Children's Health Insurance Program. So look into that. I didn't know about it until I started doing this research. But if your state hasn't expanded Medicaid, you might fall into what's called the coverage gap. And that's where you make too little for ACA subsidies, you make too much for Medicaid. You fall in this little gap. And that's right, you can actually make too little money to get help. That makes sense. So when you search these marketplaces, you really need to do your research. Can't say it enough. Don't just go off of what you read on social media or anywhere else. Don't go off of what I'm telling you. You really need to fact check. And once you get into the marketplace, you really need to find out how much is my monthly, do I qualify for any subsidies, and what are my co-pays and out-of-pockets on this? And is this going to put me in the poorhouse? All right. If you're lucky, you have employer-sponsored health care. So those are kind of nice. In 2025, the average family premium for job-based insurance hit nearly $27,000 a year. Don't panic. The worker usually only pays about $7,000 or around $600 a month, while the employer picks up the rest. So still, it's no small chunk of change, but it isn't bad. And if both of your spouses work and each has their own plan, it's often even cheaper for them to just stay on separate individual plans instead of combining into a family. So no matter how you slice it, we're all paying a lot of money. And whether it's through our jobs or our taxes or our empty wallets, we're forking out a lot of money. So then I want to go back to this question. I mean, shoot. We talked about the denial problem. And I totally talked about this with my daughter, who's been denied for her surgery on her back by United Healthcare. All right, so let's get back to that shocking number from earlier. Remember I said 20% of claims are denied? 20%. 1 out of 5 get denied. According to the data from the Centers for Medicare and Medicaid Services, insurers denied about 19% of in-network claims. Those are in-network, you guys, not out-of-network, in-network in 2023, and about 20% overall when you include the out-of-the-network. So they're denying 1 in 5. Some states fared a little bit better than others. For example, South Dakota saw denial rates around 6%. Don't know why that is. Maybe their health care is a little less expensive. Alabama sitting at a ridiculous, you ready for this? 34%. Over a third of all claims were denied. 1 in 3 denied in Alabama. All right, why? Well, about 18% are due to administrative errors, right? So even if you get the administrative error fixed, doesn't mean that you're going to get your claim taken care of. Probably still going to be denied. 16%, the services just aren't covered under their plan. So read your plan, know your plan. That's what I was saying about the ACA. Know your plan. No matter what plan you have, know what's covered. You need to know. Do the research. Don't just take it for what somebody else tells you. Find out for yourself. And about 9% are because there was no prior authorization. So they deny the claim. We didn't get prior authorization, denied. And then you can't really get them back. There's a very vague, and it's called catch-all, to pick up the other 34% to add it up to 100, right? The other 34%. And the translation, it's really simple. And you can talk to my daughter about this. Translation is, they don't have to tell you why. They're just denying the claim. And you can get caught in the wheel that goes round and round and round of put in your claim, get denied, put in a request for review, get denied, put in another request for review at a different level, get denied, right? You're in this circle, and it takes months, maybe years. Most of us can't afford that. Most of us can't do it. So what happens? So while we're paying thousands of dollars a year in premiums, deductibles, and taxes, keep in mind that your insurers are still finding ways to say no. They're not going to cover you. Paying all this money. So I believe in healthy living. Eat healthy, exercise your mind, exercise your soul, exercise your body, be healthy. And being healthy a lot of times can help you avoid physicians, doctors, which on a personal side, I don't want anything to do with them. I don't trust them. They really, it seems like most healthcare professionals push medication instead of pushing healthy living. Okay, so I'm 62 years old. I'm on 0 medications. I take no medication for anything. I'm certainly no shining light of health. I do try to stay fit. I do try to eat right. My wife, bless her heart, is a health coach. She's a health fanatic. Healthy meals, healthy living, exercising, walks on the beach, walks in the park, hikes and mountain biking, whatever it is. We're doing it. We're moving. Our bodies are in motion, and we try to eat properly. And I really say that I've gone to the doctor, and of course you never get to see the same doctor. You don't even see doctors. You see physician assistants. And I'll go, and they'll say, oh, you're not on any medications? And they seem surprised by that. You're surprised that I'm 62 years old and I'm not on any medications? Wow, we do have a problem with healthcare. That's kind of a hot take in its own. But so what can we actually do about the cost of healthcare? So a government-run system, that isn't the magic fix, clearly. I tried to lay that out. I really wanted to have an open mind with ACA, but it seems good. It can be good, but it's costing one, the taxpayers a lot of money, and it's costing the users a lot of money because they're getting into the premiums maybe cheap enough, but then they can't afford to pay the debt. So wow, I mean, taxpayers, I can see it. People are starting to tap out and say, I'm not doing this anymore. I'm tired of paying this. I'm tired of paying this. But it just never stops. There's more and more and more that we get hit with, right? So the private system, that's not really working either. Why? Well, when 20% of claims get denied and hospitals charge, so much money for an aspirin or for a plastic bottle to urinate in or Kleenex, in your room, come on, something's broken. I don't know. I don't have an answer, but what if we were to somehow cap prices on these things? Why is it, most of you know I have a home in Puerto Rico as well. In Puerto Rico, a friend of ours took their son got cut his hand or something real bad. His mom took him to the urgent care. They cleaned the wound. They sewed him up. They gave him about 6 or 8 stitches. They told her, we want you to come back in about 10 days, and we want to check, if there's any infection or if anything happens in between, come back to us right away. But otherwise, if everything looks normal, come back in about 10 days so we can get the stitches out. And she said, well, I need to pay you. And they said, no, after we get the stitches out, then we'll get you the bill. So she's panicking. She's like, oh my God, how much is this going to cost? Urgent care, stitches, cleaning, stitches out, second visit, I don't know. She goes back, they check it out. Everything looks good. They take the stitches out. Everything's good. It's healing well. Everything's fine. She goes to pay her bill. It's $200. No insurance. $200 cash money. Here's two $100 bills. Took care of it. Now that is how healthcare should be handled. That is how it should be done. In the United States, on our mainland, if you go into the hospital to get stitches, I know because I tore my knee up on a mountain bike ride and had to get, I think I had 13 stitches put across my knee. I have Blue Cross Blue Shield of Arizona. I have very good insurance. It's through the city of Chandler. I pay $1,200 a month for it to cover my wife and I. But we have very, very good insurance. Let me tell you, it cost me out of pocket $1,800 to get my knee fixed. Out of pocket $1,800. Okay. On top of that, I pay a premium every month. Do the math on that. This lady walked into an urgent care in Puerto Rico and got the same care for $200. There is a problem, folks. There is definitely a problem. We need to maybe start separating healthcare from profit. Maybe. Right now, the only ones that are making out are these corporations, these big insurance companies. Let me tell you who they are. In 2024, let me give you a taste of what the top companies made. You ready? United Healthcare Group. Net earnings. Net. Not gross. Net. This is after they're all done, right? This is net. This is in the pocket. 14.4 billion. B with a billion. United Healthcare Group 2024. 14.4 billion in net earnings. CVS Health. That's part of the Aetna Group. $4.6 billion. Centene, $3.3 billion, which is a 22% increase over the previous years. These are your big ones. These are your big guys. So while families are rationing medicine or skipping doctor visits, these companies are still pulling in billions in net earnings. That's the system we're living in. That is not healthcare, you guys. That is sick care. That is my opinion. We have to really think about how we can do something about this. All right. I've been on a rant now for 30 minutes. So I'm going to step aside. I'm going to wrap this episode up. Remember, always question what you're paying for. What am I paying for? What do I get from this? And look at the fine print. Read that fine print. Know what your options are. Always, always, I can't say it enough, fact check what you're told. Just because somebody tells you something, fact check it. Understand it. This system of healthcare in the United States is a very complicated system. And it's complicated on purpose because we can get denied 1 in 5, 20% of claims denied because of complications, right? Not because of anything else, but if we can complicate things enough, then we can deny your claim and we don't have to pay, but boy, we can still keep collecting your $1,000, $2,000 a month for your insurance coverage. So now, the more you understand it, the less that they can take advantage of you because you can fight back. So I always say this, stay curious, right? Curiosity is so healthy. It makes us think, it makes us question. So the other problem with curiosity is fact checking. If you don't fact check, then you don't have the right answer. So fact check and make sure you know. So important. Now, stay healthy, okay? Avoid those doctors and hospitals. Stay away from them. Stay healthy, eat healthy, be healthy, think healthy, okay? I want everybody to be healthy and safe out there. So until next time, be well. Always, always be well. Be kind. So important to be kind. And thank you so much. Thank you for tuning in to Joe's Hot Takes 25. And we will see you on our next episode. Bye.